Hello and welcome to the Vestibular Disorders Association's video education event. My name is Dr. Kathleen Strauss. I'm a vestibular physical therapist and volunteer with VITA. Today's educational event is brought to you by Vistim, a new home exercise kit for people with vestibular symptoms. This talk will be informative for both vestibular warriors and healthcare professionals. We'll talk about vestibular symptoms and how new products are coming to market to help those with vestibular disorders who may not have access to vestibular rehab.
So let's get underway and introduce our guest today. Ashley Contreras is a physical therapist with a neurologic clinical specialty. She started her career at Spaulding Rehabilitation Hospital in Boston, Massachusetts, and quickly found her passion for learning and treating across the spectrum of neurologic injury and illness. She has worked in multiple rehab settings, from the neuro ICU at University of California, Irvine, to an outpatient department at Kaiser Permanente in Santa Clara, California. She now resides in Connecticut, working per diem at Hospital for Special Care while adjunct teaching at the University of Hartford. Ashley went on to found her company Vistim, LLC, which improves patient outcomes through at-home visual and vestibular exercise kits. She is passionate about patient advocacy, patient education, and she believes that having the right tools allows patients to take control of their dizziness and stop letting the dizziness control their lives. She enjoys traveling with her family, rock climbing, reading, and learning. Welcome, Ashley. Thank you so much for joining us today. I'm excited to hear and talk about this. Why don't you tell us a little bit more about your background and how you got to where you are today to develop this awesome product?
Yeah, so background is physical therapist. I have worked in multiple settings. I found a passion for neurologic rehab. And in that, I found that you're also going to see the vestibular population. So at first, I was not really skilled at what I was doing. And I felt like I really needed to find more education, more resources, and really up my skills in order to help that population. So I've taken many courses on concussion, vestibular rehabilitation, and I think that my experience in different settings allowed me to see patients at different stages of their recovery. I could see patients in the neuro ICU right after their injury, or I would see them in the emergency departments, so really acutely. But I'd also see them followed up in an outpatient setting a year later where they were still struggling to get answers. I think that set me up to see a wider view and actually help make a solution.
So how did it come up? How did you come up with Vistim? And I noticed you mentioned you had experience with concussion and vestibular patients. And do those populations share some needs clinically?
They absolutely do. So the peripheral vestibular system is where we get that information. We receive information from our senses. That information is then processed in the brain. It goes and wires through the brainstem and the cerebellum, which is our little brain. And that information processing can get affected after a concussion, a virus, or anything that can occur in that area. That's where I saw all these things that looked similar. He said, what can I do, to better treat these individuals and create something unique? So I am also a mom of 3. When I started having my babies, I reduced my hours in the clinic, and I would feel like I wanted to be there more. I wanted to help people, but I was having less hours in the clinic. So I said, how can I create something where I can get to more people? Mm-hmm. It was also a frustration when they would come in and they would learn something in our evaluation, and then they'd say, well, I really wished that I saw you months ago or years ago. And they would see multiple providers. And so I said, we want to get to these individuals really early in their symptom to treat it early on. And so having a home kit and something that they can access through their own research and places like this, I felt like really helped to to get that resource to them.
It could be a game changer for sure.
I can relate to a lot of what you just said on many different levels. So let's get into it. What is Vistim? Why don't you give us a little look into what you've created?
Absolutely. So Vistim is a home exercise kit, which provides vestibular exercises. These exercises I was doing with my clients in the clinic, and typically giving out a business card, something that they would hold and do the exercises. And I said, what kind of buy-in is this? How can I make this better? And so it was with my clients that I started creating these cards in order to get them to do the eye movements or the head movements and give them a target of focus that made it easier for them to follow. And clients were saying, where can I get this? How do I get my hands on it? So I would let them take pictures and, tell them, oh, I made these at the craft store, or things that you can get. No. We don't want to go to the craft store. We actually want to be able to purchase this, like, all created for me. And so my patients were really the first ones to give me that confidence and see the need for this to grow. So Vistim comes directly to your home. It is an exercise kit that comes all boxed in. So one place, rewire, rebalance, recover. We want to rewire those vestibular information coming in and the neuroplasticity of your brain. We want to rebalance those systems so that you're not feeling so dizzy, which can create a lot of brain fog and fatigue and things that go with vestibular disorders. And then recover, really get back to doing the things that you want to be doing. So this system starts with level 1, which is the easiest set of exercises. There's 5 cards that go with that set, and then each level progresses on itself. So level 2 and level 3 progress up as you can do them without symptoms.
So are there other things like this on the market? And what makes this unique or different from other things out there?
Currently, there are not. This is the first of its kind that you can get access to vestibular exercises at home. Previously, it's thought that you want it customized and that you can only get this through vestibular rehab therapy. But those therapists vary as well. You don't know exactly if you're going to be a proper fit with somebody, and it can be difficult to get to the clinic because these vestibular specialists could be very far and remote, not really easy to travel long distances in a car. So this is the first program that you can start doing at home. It also comes with videos. So every exercise is guided with video so that you have the confidence that you're doing it correctly, and you can always refer back to those. What I love is that you can access those videos on your cell phone, on an iPad, like a tablet, while you're out in the community, and you can obviously do them at home in front of your computer.
Yeah, in an ideal world, it's always, best to get properly evaluated and get your diagnosis and to start individualized care. But as many of you, I'm sure, who are watching know that it's not always easy to access somebody that has the knowledge and expertise wherever you may be living. You might have had experience with vestibular therapy in the past and maybe just need to get a jump start back into your exercise program. But even as a clinician, you had touched on this in the beginning. A lot of patients don't want to take the time to create their own targets or stick sticky notes all over the place. Having something to offer my patients that have ready-made targets and instruments that they can use to kind of enhance their exercise program at home is extremely helpful for those who don't want to go to the craft store or can't drive to the craft store to put things together. So that's always a nice thing to have this ready-made kit. We want to have that individualized care, and a lot of times people have access to that, but sometimes we don't. Personally, also with my patients, I have a lot of people that use Dr. Google. So they'll go on and they'll Google anything they can find on YouTube, which sometimes the content out there isn't always correct or suitable for people. They're going to look and find these things on their own regardless. That's one thing about our vestibular warriors, is that they're their own advocates and they will find that information out there, which, may or may not be great. So to have a nice set of information and exercises with tutorials, written instructions, and tools that you can use at home is actually something that's a great thing to have available for this patient population. Now, are there different types of kits? Is it just for the dizzy patient, or are there different things that you offer?
There are different kits that you can see. Kathleen's going to pull up a slide. And so we start with the vestibular dysfunction kit. And that I feel like is the all-encompassing kit that includes everything that possibly could go wrong with your vestibular system, and targets anyone with that umbrella term of vestibular dysfunction, which can be anything under the sun. And then balance and fall prevention kit. This kit varies a little bit because what we're doing here is targeting your fall risk. And so in your journal, that is the biggest piece that's different here. The journal is going to document any falls and specifically the balance exercises that you're doing in order to regain and improve your balance. Concussion recovery has a specific goal of getting your vision and vestibular systems to work better together. And so that one is more concussion education, because that's a big piece of your healing, and then getting those systems to really work together and wire together. So there are different kits that you can purchase.
That's great. And that's important. And I think, as Danielle said, we support, and we would optimally like everyone to be able to get a proper diagnosis and have customized PT. There's a place, or vestibular rehab therapy. There's a place for this for alongside physical therapist intervention, or even before or after physical therapy. Have you found that it works in conjunction with vestibular rehab therapy?
Yes. So I created it as a clinician for something that can help with their home program, somebody who is also coming to see me. And what I found is that on symptomatic days, if they had to cancel PT, they were still able to do this system at home. And they had the tools at home in order to do it. So we didn't miss out and we didn't regress what gains we were doing in therapy. It also helped me to progress them easier with their home programs. As we know, clinicians are limited on time. Typically, you might be seeing your patients for 30 to 60-minute sessions. Hopefully one-on-one, I feel like is ideal. But giving some of that time to creating the home exercise program and looking for your exercise printouts and getting copies and creating those programs also takes time. So with this kit, because we have the 15 exercises laid out, we can simply progress them from sitting to standing or increase the time variable. So the clinician can create this and customize the current regimen for each individual client. And you could do that within seconds, because there's a nice PDF handout that you can simply just kind of check off, and the clients already can go back and refer back to the videos that they also have access at home.
This is timely. Sorry, Danielle. This is timely because of the increase in telehealth. And when we are evaluating patients over the distance, this might be a way for telehealth therapists to get a kit to somebody and direct them using those products.
Absolutely. The pandemic really opened up the telehealth platforms, which I know Danielle was using prior to, especially also with Balancing Act Rehab. And that world has really evolved. So there are so many more people accessing telehealth. And how nice is it to have the tools home in one place where you can say, okay, I want you to get out exercise 1, level 1, exercise 1, and I want you to do it in this way. So you can really work one-on-one and still customize programs. You can modify any of the exercises too. So I'm not against, changing it in some way. The cards are set where there's a instruction to each one, but it can be modified in so many different ways. You can incorporate these cards into your yoga routine. As you're doing your yoga routine, you're also working your visual skills, which helps you have a focus point and progress your balance. So really, it's endless opportunities to now dual task these exercises and progress from home.
Something that I like about this kit and having kind of all the exercises at your disposal and a great graded progression of how to do these exercises is that I can have a patient feel more comfortable with how they can progress themselves at home. So in the instance of telehealth, I've had a patient where we started with the exercises that were just enough to generate, some symptoms without overdoing it. And she was doing so well. And instead of checking back in with me before progressing, she decided that she was going to try to perform the exercise in a busy supermarket aisle while walking down with her shopping cart. And oh man, was that too much. It just put her over the edge and was terrible. Her symptoms were really increased and she felt like she had this big step back. But if you had these exercises in front of you, you can see how things are graded and progressed. You're less likely to have a patient kind of overdo it. They can kind of look at the feel for natural progression and feel more comfortable with their home exercises and be likely more consistent with it, which is what I like. Is there anybody that this kit is not designed for? Are there any contraindications for those people who are looking at buying a kit?
Yes, so this is not ideal for BPPV because that is a mechanical issue, which really we need to find out exactly which canal it is and treat it with canalith repositioning maneuvers. So it's not recommended for somebody with BPPV because those head motions that are meant for recalibrating and rewiring the neuroplasticity is not the appropriate treatment for them. So it wouldn't help those individuals.
Well, people in the comments are already looking to purchase it. And so I want to ask you to jump ahead. We're going to go ahead and talk more about the product, but talk about the cost of the product, how they get it, and about the special offer that is today. Because I don't want someone to go ahead and push the purchase and then realize they might have missed a coupon opportunity.
Absolutely. So we'll get right into the discount. So for Vita members and anyone watching and seeing this, we have code VEDA15 for 15% off of our products. So the vestibular dysfunction kit is $115. That does include your shipping within the United States. And this is something that can be purchased internationally. We've shipped as far as South Africa. So that would have an extra cost associated. You'll see what the cost is when you add that to your cart and have your location. But $115 and offering 15% off through the month of May. So we want to be aware of Balance Awareness Week and also promote that for Vita. We're going to go into unboxing the Vistim kit. So when you receive this at home, it's something that you're going to open, kind of like Christmas morning. And the pieces there are going to come out. So there's different things. There's instruction cards. The website is vistim.com. That's going to be your resource of being able to access the videos. The videos are sent through your email. So if you subscribe when you sign up, then that link is sent and you can access that, bookmark it so that you have access to those videos. This one is a card holder. And so here, what I love about this, you don't have to hold the exercises out and create shoulder problems. So that's fatiguing, especially if we're wanting to build this up to about 12 to 20 minutes a day, which is the ideal time for vestibular exercises. So having that card, you can move it up and down. You can keep these pieces out as a reminder to do these frequently throughout the day in small bouts. I feel like that's ideal because when you go to vestibular rehab and you have 30 minutes or 60 minutes to work on exercises back to back, it's extremely fatiguing and symptom provoking. So breaking it up is completely the way to go. There's a Brock string in each exercise. What that works on is getting your eyes to work together at different distances. So can they jump from point to point? And so that Brock string can be adjusted for each person. How far do you want those beads to be coming into your visual field? How challenging do we want it? When we get our eyes closer, that's more challenging. When we have our eyes looking out in a distance, that's a bit easier. And now everybody being home, working from home, and being on computers, that's really challenging for us. So every 20 minutes, we should be looking 20 feet away. And so just another reminder for our visual health and fatigue and strain there. Each kit also comes with a magnet. This makes it really easy for you to adjust the height. So if you're working at sitting, you can start at a sitting height on your fridge or wherever you want to leave these. And then when you progress to standing, you can also use this for children. So kids with visual problems and difficulty reading can train their eyes to work better with these exercises. And so something there is that, these children can have it on the fridge where it's something that every time you're going in for a snack, which they love their snacks, you can remind them to do some quick exercises. There's also a journal included in every kit because I think having a journal and writing down your vestibular symptoms is so important to your recovery, for you to celebrate your wins. So how do you feel about, when you can do something that you weren't able to do? You want to celebrate those small wins. So writing them down will make you more aware of those wins. And the journals are pre-filled.
Which I love. I love that about your journal, that you have those prompts and you already have things in there for people to start paying attention to and documenting, which can be extremely, extremely helpful if you are still in your journey of reaching a diagnosis. Bringing that to whatever doctor, specialist, physician, physical therapist that you're going to see is going to help paint a better picture for them to help get you diagnosed and feeling better. So I have to say, I love the journal aspect of all of this as well, because not only is it a great place to write everything down and keep it in one place, but you prompt every person to kind of look and pay attention to the important things, which is good.
Absolutely. At first I was thinking, for price point, I'm not going to include it in every kit. And I really felt strongly that it really improves the kit itself because it's tracking down your symptoms and making you more aware. That vestibular diagnosis comes primarily from your history, from reoccurrence of things. So this really helps for them to document and keep it really clear. The balance program instructions come also printed out, so everything is there in writing. And I wanted to keep all the instructions short. I've handed out instructions of vestibular exercise, one exercise, which is a page long. I'm like, how are people supposed to be reading this entire, instruction sheet and coming away with doing the exercise correctly? So I wanted to keep them short, and then you can also access those videos to create or to make sure that you're doing it accurately. The kits come with balance markers. So these are floor markers that you can put around your feet for different targets, visual targets of working on your balance, being able to step over objects, being able to take a longer step, and ultimately get out walking in, hiking, nature, environments that are really meaningful to you.
And those targets they're kind of rubbery, right? So they're not going to slide around on the carpet or the floor or create some
Correct.
Sort of...
They are non-skid. Yeah. Yeah.
Perfect.
And then each one, so we also have these little pop sticks. So part of the exercises are done with these. What I love, so your therapist can also customize these. This one is not an exercise that's included within the program, but you can easily be working on your saccades, which is the eyes moving from one place to another, a quick eye movement from left and right. So I'll show you these so that you can see them, what I'm looking at, but I'm looking left and right. quickly, or up and down, diagonal. So you can really modify and customize all of these exercises, giving you the tools in order to do so, either through telehealth visits or in person, and then you go home with that routine. There's a classic TheraBand, so our resistance band for building strength, which goes along with balance, and that can also be used in many different ways. And then the most important piece of the kit is the exercise cards. So each level comes together. There's 5 exercises in each of those levels. And then each one is labeled for ease, so you know which exercise you're working on. And your therapist would also know this. And I'll get into the clinician kit so that clinicians also have a kit in hand in just a little bit. Remind me to pull that up. And so these cards we're going to go over. Let's do exercise 1, level 1, which is our blue exercise card. Look at this screen. What I want you to do is have your eyes on the number 1. Try to focus right there. Just keep your eyes stable on the number 1. And then they're going to jump over to the number 2. Jumping to the 3. And jumping to the 4. So we're creating a box, 4 square, with our eyes moving to the right, down to the 3, to the left, and up to the 1. Now we want to make those clean jumps, and we want to do it as quickly as possible. So eyes are moving from 1, 2, 3, 4, 1, 2, 3, 4. And this is visually stimulating. So it might be something that you use when you're driving. We have to look at the stoplight. We have to look at our speed. We have to look near and far. And so all those eye movements can be causing symptoms. This is something that we want to train so that it's not so symptomatic. This can also be used where you're creating head movement. So with your therapist or at home, you can modify it to now my nose is moving to the 1, 2, 3, 4, 1, 2, 3, 4. So you're incorporating more of that head movement and vestibular system.
Let me interject there. I want to make sure that I think you said to use it while you're driving, but I want to make sure that the audience understands we're not going to be using the exercise while you're driving, but it simulates or practices some of those saccadic eye movements that occur in an activity like driving or shopping or moving through a busy place. So just in case anyone else heard it the way I did, you don't want to be practicing that while you're driving. And you're saying you can do it with head stable or with head moving. And it's when the head is moving that the vestibular system is engaged. So you have eye exercise programs that handle both those central visual components of saccades and also those visual vestibular dysfunctions with the engaging the vestibulo-ocular reflex once the head moves. So I like that. And it might be that a person tries the different things that you suggest. And I think I used to get frustrated if patients were doing things they didn't need to do, but I do, for example, saccadic eye movements not being a vestibular dysfunction, but a lot of people do benefit for them. And so sometimes I tell people, if you're doing the exercise and it's very easy, then you probably don't need it. So if they're doing the eye jumping and it's very easy for them and doesn't provoke symptoms, would that be a good way to decide maybe you don't need this one? You need to have a certain level of challenge or provoking difficulty to know where to start and what to do?
Yep. So the program starts at level 1 because it's the easiest and we want to make it safe to get started since this is something that you can do at home. We also want to make it safe to do at home, that you're starting out exercise that you would do on a regular basis. So you can go walk on a treadmill, you can start using weights, you can also start training your visual and vestibular systems and progressing up from there. And so level 1, as soon as you can do any of the exercises for 30 seconds with no symptoms, you're going to jump up that specific exercise to the next level. Level 3 ultimately gets more complex, busy backgrounds, more motion going on, more integration of the visual and vestibular systems. And I do target the visual, vestibular, and somatosensory systems, because I found with my clients, when I was only doing one system, they only got better to a certain point. Our balance is ultimately a combination of how well those 3 systems work together, and the information, how do they weight those differences? How much do we need our vision and to rely on that? And how can we downweight that sometimes if we're really relying on our vision in order for the vestibular system to work a little bit better and integrate better?
Now, we did have a question in the comments about wearing glasses. If patients wear glasses for readers, should they be using their glasses during the exercises, or is that explained in the instructions?
It is, yep. So you would want to wear your glasses, and then you can also do these at different distances, which is a component that has been researched, that you don't want to only train at one distance. So stepping back and forth. And when you get to a point that you can do these exercises while standing and walking, you're walking towards and away from those cards. So we're getting that variability. If you need it for reading distance only, then you might not want to use them when you're training up your vision close, but when it's appropriate. And I specifically did not laminate the cards because of that glare. And they've held up. I use these in the clinics on a daily basis. So just the cardstock itself, without being laminated, has held up very well. Great question.
That's good to know. So we looked at the, did we get through the kit, and are there more? So we talked about visual things, and are there things specifically for balance? How are we, or maybe pick up where you left off?
Yep. So level 3, level 2, we get up to the purple card. We're training our VOR. So here we are introducing a head movement and keeping the eyes on that target, on that focus.
You want me to show that one?
Yes, perfect. So we got that card up. Go ahead and keep your eyes on the letter Z, and then turn your head just only to the left. So we're going to go only one way, trying to keep your eyes on that target. And then you want to speed it up. How quickly can you go without that letter Z blurring? And this can be done to the left side, to the right side, up and down, and then through the middle. And what that tells us is it one side? Is it a hypofunction? If it's a hypofunction, we want to be training that to the weak side. So which way is it difficult? And if it's not difficult, we don't need to do it. So we can specify this to only doing it to the direction that is causing symptoms and trying to improve the speed and accuracy of those eyes moving. So now we're training that vestibular ocular reflex, which is important, keeping our eyes on a target when we move our head. Of course, starting seated, working up to a standing, and then adding in balance challenges. So when we're progressing that as a PT, I also felt like I would get stuck where somebody could do it seated, they could do it standing, but then they couldn't do it if we modified their foot position. And so what I also use now a lot and team them together are the urban poles, so activator poles, which I know are also on your website, accessible to people. And then let me show you what those poles do. They give you that stability to jump to the next level when it might be difficult for somebody. So it looks a little bit dark, but I think you could see me good enough. Now when I have these poles, I can change my foot position. So putting one foot in front of the other, and then I can do these visual exercises, keeping my eyes on that target, and I can have it up on the fridge because of the magnet, and training this where I have a little bit more stability because of the poles. So I love being able to make that next jump of difficulty in a safe way.
Safety is always important.
Mm-hmm.
And then we've got our floor markers. This one might work in this way if we move this. So our floor markers, we've got they're going to go all around. And then I'm taking my right foot and hitting each of those targets. So front, back, crossing. The closer that they are, the easier they are for me to touch. I'm working now on standing on one leg while moving the other one. And if I move them further out, then I have to reach further. Again, if I need that extra support, I can be using the poles or a countertop, something that makes it safe for me to do.
Are those balance exercises? I love that. Are those balance exercises in all the kits, or
they're in the vestibular dysfunction and the balance and fall prevention? They're not in the concussion kit, primarily because of that reliance on more of the visual vestibular processing, because it's that central dysfunction. And I find that the balance is pretty good, especially if I'm seeing like the athlete population. They need a little bit of a harder challenge, and they need these things integrated together in order to make it really specific to them.
Now, can you talk at all, if you can you talk about any of the literature that supports a low tech or home rehab and how it compares to getting supervised, visits with more technology in the clinic? How do they compare? Is it still something that works well?
It is. So doing the exercises at home versus doing them in, a clinic environment, I think that there is some literature that you could find saying that it is better to do or you'll have better outcomes if you're doing these exercises in the clinic with a trained vestibular therapist. But on the other end of that, you can also find research that says the outcomes at home are just as good. Mm-hmm. There's literature. What they did was they took individuals who had unilateral vestibular hypofunction for various reasons. What they did was give them a 30-minute walking program. So no vestibular rehab, just that 30-minute walking program. And by giving them a pedometer that they could track the actual walking, just by providing that toolkit, those individuals got better than the other group. So we know that motion, movement, exercise in a general sense can create a really positive outcome.
And I'll say, as a clinician, especially with telehealth, right? So when I treat vestibular patients, over a teleconference such as this, we're not one-on-one with the patient with our hands on them in a clinic, but we're giving them the tools that they need to be consistently exercising and moving at home. So I always tell my patients, I'm not doing anything magical to fix a vestibular dysfunction by seeing you once or twice in the clinic for, 45 minutes each week. It's the consistency of your movement and exercising at home that really makes a difference and progresses therapy to the next level. Now, say somebody has done vestibular therapy in the past, it's been a long time, they haven't gotten back in to see their physical therapist. Could this still help with some benefit? Can this help the patients in their home?
Absolutely. So it's perfect for them. Anyone who has a vestibular system, which is all of us, the system can, wax and wane. So it can be taxed when we have a cold or certain time of the year when we have allergies. If there's more inflammation in that area, then your vestibular symptoms might heighten. A virus can definitely re-amp everything, even if it's not the same virus that caused the vestibular disorder in the first place. And so while you have those regressions or those times where you just want to do the right thing to get better and get out of that cycle, this is the perfect thing to do at home. And you can always pull out your kit as soon as you have your symptoms. You don't have to wait weeks to get into a clinic or get that referral to the specialist. You can start doing these things, because you have them at home. I almost feel like this, as soon as anyone has a vestibular dysfunction, they should have this kit. Like, if you work for an insurance company, if the insurance companies are listening to me, this will help your clients because they have access to the tools. So it should be something that if you have, a vestibular disorder, you should be issued this kit right away. That's how I feel.
I think Kathleen alluded to this earlier too. For those of you who purchase a kit and have a kit at home, will know the things that you need to work on and the things that you don't need to work on. So say, for instance, balance isn't an issue and it's mostly just vestibular. You're not going to feel that need to have to do all the balance exercises, and you're going to focus on the things that feel challenging to you or feel that are helping your symptoms. All of you watching know yourself the best. You know what symptoms you're experiencing, and you should be able to figure out using all the tools that your kit provides what you should be working on and at what level. Your body will give you that good feedback as far as what's too much or what's too little, from what I can tell.
Yeah, and I'm thinking about the audience and how people decide whether or not this is for them. And I think there are a lot of people out there who do know for sure what they don't have. And maybe they don't know what they do have. So I just want to emphasize the fact that people with dizziness, balance problems, visual problems, these symptoms that we're talking about here, definitely need to rule out all the things that can be catastrophic or require medical management or medical intervention. But there are so many people out there who are told, it's not a stroke, it's not a tumor, it's not this, it's not MS. And they go through all of these things and they still have symptoms. And so we do want to emphasize that it's important to rule out with your medical doctor all types of things, because many different things cause symptoms of visual impairment and imbalance and a sense of instability or disorientation that we talk about in the vestibular realm. But I do believe that there's a population of people out there and those who are watching who aren't really sure what's wrong, but they have gone through all the tests and they know what they don't have. And that's a long list. So for those people, if you're suffering from sensitivity to visual motion or eye weakness, that you feel like you're having trouble focusing and reading things that are moving or focusing while you're moving, and some of that brain fog and dizziness that comes with just head movement, that things feel jumpy in your vision perhaps, or imbalance. This would be a good way, because if your system is working well, these exercises will all be easy for you. They're all going to be easy for you if you have a normal vestibular system, right? It will, I think some of these exercises will help a variety of problems, especially the balance ones. So even non-vestibular balance problems can benefit from some of these things. Last, I want to say that I do feel like with COVID and the change in people's ability to get out into the community, the eye weakness is significant. And you touched on it earlier, but I want to just reemphasize the fact that we're used to being in and out of our homes and moving around and engaging, and that the skeletal muscles around our eyes are weakening because we are sitting and viewing things in close proximity over the last 2+ years. And so I think that your approach to training the eyes, again, with the Brock string, is potentially helpful to many people. Check it out and try them. And if it's all easy for you, then you don't need it.
Yes. And so to speak to the clinicians as well, this is something that I am opening up for clinicians to have the kits in their clinics. They can start it with clients and, if appropriate, make those referrals. So there is coming soon a certificate for Vistim that would be online module, and for places that want in-person demo, they can reach out to me as well, and we can set that up now that we are getting back in-person continuing education. So then clinicians, there will be a large database of clinicians that are informed on Vistim and feel confident in using the kit so that they can translate that to their patients and make those appropriate referrals as well. Because I think it's always nice to hear from your, ENT doctor or your vestibular therapist that this is appropriate for you.
Now, what kind of
clinician kit is also found on Vistim. And what this includes, there's a whole kind of carrying case. You get the concussion kit, the vestibular dysfunction kit, and then pieces that go with like training for your eye exam. So here, if you're in a large setting and you're not only seeing vestibular clients, or if you're the vestibular therapist, you have something that you can take into the treatment rooms. You have all your tools you can add to the kit. This comes with cervical laser for cervical proprioception, things that can go on the wall, different pieces and components to that clinician kit, which comes with the training as well.
Very nice. Now, is there any sort of, what can people expect as an outcome if they follow your program? Is there any sort of anticipated outcome? Does this differ between diagnoses, age, populations?
Definitely, it would vary. I like to tell my physical therapy students, it always depends. Everything depends in neuro and when the brain is involved, because things flex, they change. So some individuals, if you have a vestibular hypofunction and you have this new loss on one side, we know that the research says you can train for that loss and you will maybe not correct the damage, but your brain recalibrates and the information is then no longer causing symptoms. You won't have dizziness unless you're maybe on a boat or like in a very challenging environment, but your brain can recorrect for that imbalance. Other things like vestibular migraine are things that we have to manage through exercise, lifestyle, and sometimes medication. So that is something that the exercise itself will help you to function better in your life and will give you a tool set that you can, do it as needed and get that continuous exercise and vestibular stimulation so that things are not so bothersome, but it will not, in that diagnosis, correct or say that you'll never have the same imbalance again.
That's good information. One more question, and then we'll make sure we'll go to the comments and answer any questions. So if you have any questions for Ashley or for Danielle or I, go ahead and put them in the comments. One more thing, if someone who has seen a doctor and has some of these symptoms and wants to try the program, how long do you think it would take before a person starts to see some improvement in this? What is the expectation? Try it for how long and see if it works?
The research for vestibular rehab is typically looking at like a 6-week outpatient protocol. And with that, it's home exercise plus 2 visits typically for outpatient. So if we're looking at the evidence behind it, after about 6 weeks, we should see some improvement in that. And you can always reach out to myself if you have questions, if you have difficulty getting, used to the program. In addition to the videos right now for purchasers, I'm also doing like a 30-minute free webinar to unbox the kit and get started on those level 1 exercises together so that we can kind of get a sense of where you're starting from. But I'd
That's
say
helpful.
at 6-week mark, you should be starting to progress, jumping up to potentially the level 2 exercises, or noticing that you might be able to go for a longer walk out in your community or enter a store that you weren't able to enter. So you definitely want to look at those small wins that should be celebrated. It might not be 100% recovery at 6 weeks, which is very different than getting better.
We do have a question in the comments asking if there's any way that the kit addresses the anxiety symptoms that can come about from vestibular dysfunction or doing the exercises.
That's a really great question, because I think anxiety in today's society is such an important factor, and something that is creating a lot more vestibular dysfunction. So we found this dizzy, anxious cycle where those two things kind of get into each other's world. It's the same area of the brain, and the functioning there. And so exercise is one of the very top evidence-based things to help with anxiety. And with the exercise program, stimulating that brain, that cerebellum, where that information is processed, has been studied a lot in pediatrics. They're looking at stimulating the vestibular system and then making kind of that anxiety piece go down. So by working the vestibular system, you should be reducing your anxiety as well.
I like that. I think by improving those parts of our body, like orientation to vertical and balance and equilibrium and eye movements, our brain can relax a little bit. And so when we feel more confident and comfortable because things are working for us and we're not afraid of falling, or can think more clearly, it does tend to reduce the anxiety. We didn't talk about dosing, but I'm assuming in some of your instructions and so forth, you talk about how many times per day or how many times per week, just to emphasize to vestibular patients, it's important, isn't it? How much, how many, and how regularly to provoke some symptoms and to exercise those systems.
Yes. So the research, if it's acute hypofunction, it's 12 minutes per day. And you can split that up, however, into smaller increments. For chronic conditions, it's 20 minutes a day is our clinical practice guidelines through the APTA that have given those outlines out. And it should be done daily. This is something that we use. Our vestibular system is always in use every day, all day. It's a gravity sensor. So it's something that should be repetitive. And that does come in the initial general how-to video. You can also check out on our YouTube page and start with those instructions are available.
And what about double vision? If somebody has double vision, can they still use your kit? Is this a symptom that might resolve with exercises? Is that something they should be concerned about?
I'm sorry, can you say one more time?
We have a question in the comments. Somebody asked about double vision. Is double vision a symptom of vestibular dysfunction, and will the exercises in the kit help with that?
It can. So double vision can be associated with vestibular dysfunction, and especially that central processing of the brain. So you would want to see someone, you can actually listen to one of these. You guys had some specialists. I think Danielle or Kathleen can speak to this, but there is a screening tool that you can do at home to see if that's something that's appropriate for you.
Absolutely. That was, I think, a nice little callback to our talk with Dr. Debbie and Dr. Mark about binocular visual dysfunction. So that's also a good listen to if you've got double vision. If you want to take a look at that, make sure you go back into our Facebook or our YouTube and watch that video. What about somebody with MDDS, all-day debarkment? Is this something that they could utilize to help with symptoms?
Yes, there's a lot of research coming out. There has not been historically a lot of research on MDDS, but getting that vestibular system to relax the information and get out of that rocking sensation is something that can help definitely be done through exercise and through these movements.
I think the important thing is that these exercises can't hurt you. They might help you, and they might not. And it does seem like these are simple exercises that are part of our functional ability to move our eyes, coordinate with our vestibular system and our balance and equilibrium and somatosensory systems. So again, doing these certainly couldn't worsen or hurt anything. They just might be helpful. And if they're not, then continue to seek other remedies. But I think that it looks like if you perform these exercises at home in a safe manner, protect yourself from falling with the strategies given. Of course, if you're moving your head, be mindful of your cervical spine and the limits of your movement, and any changes you might have in your neck that may be worsened by head movements. But be your best advocate and be your best healer. That I think we in this audience have a great ability to know ourselves, to know what we can do and what we can't do. So this is a great option for those who feel comfortable taking it on their own, because as Danielle said, people are looking anyway for help.
Yeah, I look at it like any exercise, right? We can start a yoga routine. We can start a walking routine. We can go to a gym and hop on any exercise. So we want to be building that strength. And the vestibular system is just another system that we have ignored in the past. But it should be trained like anything else. And as we get older, we see that system reduce. So it's something that if we start sooner than later, we can get ahead of it.
Absolutely. I have one last question before we call it a day. We have a viewer here that was in a car accident and has a history of beep and BV. They haven't had a flare up of their beep and BV for a few months, but are they able to still do the exercises as long as they also do their maneuvers for beep BV?
Absolutely. Yep, these are not going to undo your BPPV. There's nothing that's putting your vestibular system into that much of a positional change. So they are safe to do.
Great. Well, we do want to remind everybody that, yes, we really, really recommend that if you are experiencing vestibular symptoms, especially for the first time, getting evaluated and diagnosed by a specialist is, probably our top tier priority, which you can find providers on vestibular.org on our provider directory. But as many of you who are watching this, probably looking for answers on how to help your symptoms, you've either been through the diagnosis or you haven't been diagnosed yet. You've been through the gamut. You're still having symptoms, or you've tried vestibular therapy in the past, and you need that extra little boost for that home performance of exercises, or you need a retouch, or you just want to start getting ahead of your symptoms while trying to figure out your journey back to balance. It sounds like Vistim is an absolute wonderful product that's safe to use, thoroughly put together by all of the knowledge that you have created and given us in today's lecture, which has been absolutely amazing. We really, really appreciate the time that you spent talking with us and talking about your product. This has been wonderful.
Thank you so much. I created it for the patients. It really came from a need that I saw. Wow, these patients are really, needing something to do at home and make it more accessible.
Let's tell everybody one more time where they can get the product and about the discount.
Yep. So vistim.com. And then the discount is VEDA 15 for a current 15% off.
Beautiful.
Any of the kits.
Very good. Well, that brings us to the hour. It went by fast when we're talking about something interesting.
Thank you so much for having me. Thanks to everybody for joining and for all your comments and questions.
Thank you very much. Until next time, signing off.
Go to vestibular.org for more videos like this one. Also there, you'll find information, support, and encouragement to help you find your journey back to balance.